what does treating Afib early really mean?
So we typically don't consider atrial fibrillation to be atrial fibrillation until it's occurred more than once, because one time could just end up being one time. But once you've had more than a single episode of atrial fibrillation and it lasts for more than 30 seconds, you've gotten the label as having atrial fibrillation. Okay. And if you have symptoms from your atrial fibrillation and it's clearly been diagnosed as atrial fibrillation, you're right then and there potentially a candidate for ablation. Some people would elect to try a drug at that stage and see if a drug will suppress atrial fibrillation. Others are not willing to accept the risk, because for some patients, depending on the other medications that are on or their background, those drugs may not be acceptable and it may not be reasonable to try one of those drugs. Or patients may decide that ablation, after they've done the research, is a reasonable early option. So atrial fibrillation is a progressive disease, and atrial fibrillation in many cases becomes more frequent and the episodes become longer. And also, as we get older and we rely more on the function of our atrium, it can actually become more symptomatic. So someone may have had 10 years of atrial fibrillation, and the first 8 years they could put up with it, and the last 2 years it's unbearable and they can't exercise or even take a light walk. So typically, the earlier we can start to address someone's atrial fibrillation, the better. And that begins with seeing someone who's a heart rhythm specialist early on in the process.